As with the education and assessment services provided, the intensity of your remediation activities included in your scope of services will most likely vary. Intensity in a home-based visit describes the extent or magnitude of the assessment, remediation, or other intervention. For example, a visual assessment is considered a lower intensity approach than an assessment that includes collecting dust samples. The Guide to Community Preventive Services defines 3 different levels of intervention intensity. Low-intensity interventions will cost less, but may also deliver more modest health improvements. High-intensity approaches cost significantly more, but may yield greater health improvements. The different approaches can build on each other, but the challenge is to find the right balance for each client, as well as your program or service. Now we will click on each level of intervention to learn more about them. Low-intensity interventions. At a minimum, low-intensity interventions and case management include advice on recommended environmental changes to be performed by the members of the household, and often provide at least one low-cost item, such as allergen-impermeable mattress and pillow covers. They may also include basic asthma education and coordination with the patient's medical home or primary care team. Pest control example. Low-intensity interventions for pests might include education about reducing pest access to food, water, and harborage, and providing the family with gel baits. Moderate intensity interventions. Moderate intensity interventions may include the provision of multiple low-cost materials and the active involvement of the trained home visitors. Activities in this category include the provision and fitting of allergen-impermeable mattress and pillow covers, small air filters and dehumidifiers, integrated pest management, professional cleaning services or equipment, and minor repairs of structural integrity. Moderate intensity interventions often also include asthma education, coordination with the patient's medical home or primary care team, and the use of a CHW or social worker to help the family meet basic needs. Often, basic needs must be met before the family can focus on asthma education. Pest control example. Moderate intensity interventions might include activities from a low intervention level, plus actions such as providing caulk to seal cracks, and referrals and or payments for limited IPM or professional cleaning services. High-intensity interventions. High-intensity interventions involve structural improvements to the home, including carpet removal, replacement of ventilation systems, or extensive repairs of structural integrity. High-intensity case management may include lower-level interventions, plus coordination with schools and other caregivers, psychosocial support, and connection to community resources. Pest control example. In addition to the activities provided in the low and moderate intensity interventions, high-intensity interventions might include contracting for repeated IPM services, repairing holes and/or cracks, and building level interventions to address pests that are in the home.